I come across health literacy every day. It's so important in my work because if patients don't understand what's wrong with them, firstly, they live in fear of what's wrong with them. Secondly, they don't take the medication or the treatment I advise, and that means that it's less likely that to get better. So it's really a key feature of my work on a daily basis. Health literacy is about using simple language, but also breaking down ideas. So I'll give an example. Patients often are told they have hypertension. First of all, that's not the simplest language. The simplest language to use is they have high blood pressure. Patients have a conception of high blood pressure. They often worry that that means something's going to burst in their brain or that it's a really serious disease. So what I always do is break down what the concept is. So I say to patients, blood pressure is actually just the pressure of blood in your system. You have a heart that pumps hard and you have vessels. The thinner the vessels, the higher the pressure. And in fact, it's not a disease, it's what we call a risk factor. Because you have that pressure in your bloods, it causes more wear and tear in your system. And over a long time, 20, 30 years from now, you're at higher risk of getting a heart attack or stroke than someone who has normal blood pressure. So we sometimes give you a tablet to bring down that blood pressure, bring down the risk of you having a heart attack or stroke in 20 or 30 years. So you're as well as anyone else. The only difference is that you're on a tablet to manage your risk, where someone without blood pressure has the same risk, but they don't have to take a tablet. I'm aware that when patients come into the surgery and that they're nervous and they also don't really know what's happening. So it's really important that we make sure that they understand what is going wrong with their health and what they need to do about their health. Because if they don't understand this, that's a problem for them managing their health and it's a problem for the health service.